It's been 6 months since my hip replacement surgery, and I'm back to doing all the things I love. My name is Tom O'Grady. I'm 66 years old, and I got hip replacement surgery on the left side. I would say the level of my activity before the surgery was about a 4 out of 10. Little things were becoming very difficult. Getting into a car all of a sudden started hurting me. I couldn't golf anymore. I couldn't swing. My hip was locking up. And cycling, I couldn't get my left leg up high enough to get onto the bike. I started feeling older, and I didn't like that feeling. Those were my first warning signals that it was time to go get surgery.
When Tom first came into my clinic, he was in a lot of pain. I like to watch patients walk into my office because I can tell whether it's a hip or a knee and just how much pain they're in just with every step. Tom had a bit of a limp to him when he was coming in. It was the little things that really bothered him. Getting in and out of the car, getting his golf bag out of his trunk, getting up in the morning, getting his shoes on and such. After we talked about his limitations and also the things that he'd like to continue to do in his life, we discussed several options. None of these things were helping his hip pain.
I was nervous. I wasn't even sure I was going to go through with the surgery. But when I decided to go through with the surgery, they were fantastic.
His x-rays demonstrated end-stage osteoarthritis or bone-on-bone arthritis. We were able to explain to him the options, including non-operative treatment and, again, surgery. We decided that hip replacement was in his best interest. From then, it was off to the races. We got our team involved, and ultimately, were able to provide him a great surgery.
The care that I got from Dr. Karras' team was outstanding. You know, I'm in the sports field, and I felt like an athlete when I was working with them. The way they paid attention to me, they were on top of things from the minute we spoke about the surgery, what I should expect with the surgery. They were very insightful. They were giving me heads up of things that might happen. So if there was something that might happen to me, it wasn't a surprise to me. I never felt like I was out of the loop or I was forgotten. They always engaged with me, and even 6 months later, I had a 6-month follow-up that I just finished a survey, and I really appreciated having that to me because I feel like they really cared.
The personalized care that we provide our patients is really what sets our practice apart. From the minute you are given a surgical date, you have full access to our whole team. In addition, you'll receive text messages as well as communications with team members on an almost daily basis from the day you have surgery till about 6 weeks post-operatively. We are interested in only one thing: you're getting through your surgery as successfully as possible.
Hip replacement surgery has changed my life. I want to start hiking again, and I would never have thought of hiking 4 years ago. There was too much pain. This has really provided me freedom, and I would recommend anybody who's thinking about doing this and who has any hesitations to do it.
When Tom walked in to his 3-month post-operative visit, he no longer was walking with a limp, and he was walking faster than I'd ever seen him walk. It was a great day for both of us. He talked about being able to get back on his bike without pain, being able to get back in and out of his car with no issues, and being able to walk the golf course.
The thing I'm most excited about is I can work on my golf game again, because it needs a lot of work. But when it's all said and done, the fact that I'm out there doing something I love is really the reason I went through the surgery in the first place. I didn't feel like I was 66 years old, but I was acting like I was 66 years old. And I would recommend anybody do this moving forward. It's really something special, and it's changed my life.